Hi, I'm Barb Nanelli. Today I'm going to be doing my cardiovascular peripheral vascular assessment. So we'll go ahead and start. This is my patient Justine. Hi Justine, I'm Barb.
Hello.
I'm going to be your nurse today, doing your cardiovascular and peripheral vascular assessment. So I'll be checking from your neck all the way down to your toes. Do you have any questions for me?
No.
Okay, everything will be confidential. All we have to do is get ready here. So you're in the right position. So I'm just gonna wash my hands and I will clean off my stethoscope with alcohol swab. All right, so we'll go ahead and start. So the first thing that we're gonna assess today is the carotid artery, and that is located in your neck. You have one on both sides, so you have your right and your left. I'm gonna go ahead and just assess her on the right side today. So with Justine, since she's pretty thin, you can actually see her carotid pulsating in her neck here. But usually to find a carotid, you want to go medial from the sternocleidomastoid muscle here in the neck. And you can kind of feel, but like with her, like I said, you can see hers pulsating. So you just want to go ahead and feel that. It's pulsating really well here. Go ahead and turn your neck to my side here. I'll look on the left side. And you can see it right there. Alright. And then the next thing we want to assess, go ahead and look forward. We're going to assess the internal jugular. And to find that, what you want to do is kind of look at the side of the neck here and look for your pulsations of her heartbeat. And with Justine, I can see hers down here in her sternal notch, right there. So you can feel it right there. And so we're going to go ahead and measure her venous pressure there. And to do that, what you want is you just want a straight edge and a ruler that can measure in centimeters. So you take your straight edge right there in her sternal notch, and then you measure up to the highest point that you see that pulsation. And with Justine, it's about 1.5, which is normal. Anything below 3 centimeters is a normal assessment of that. So when you feel her carotid, you want to feel for upstroke and amplitude, how fast or how hard it's beating there. Hers is normal. So that's good. So now we're going to move down to the heart tone assessment. So what you want to do first is you want to assess their chest, and just kind of look to see if there's any pulsations that you can see visibly in their chest, and then you can go ahead and do the inspection. So what you want to do first, you start at your right border of your sternum here, and you want to find your second intercostal space. So start right there, and this is the base of the heart. And then you want to move over to the left, second intercostal space, and then just move your way down on the sternal border there. So then 3, 4, and then the 5th intercostal. And then the next thing we want to do, that area is called the Erb's point. The next thing we need to assess is her apical impulse. And to find that, you want to go 5th intercostal space, walk your fingers over to the mid-clavicular line, so right below her breast here, and you should be able to feel a pretty strong beat. And with Justine, you actually can, because she's pretty thin. If you weren't able to palpate that, what you would have the patient do is roll up on your left side, and you'd feel in that same area. And with her, you can feel it. Okay, back. So the next thing you want to do is you want to listen to your heart tones. You want to start with the diaphragm of the stethoscope, and you essentially listen in the same places that you palpated in. So you start on the left sternal border, the second intercostal space. You move over, to the right, then you move over to the left, sternal border, the second intercostal space, and then just work your way down. Third, fourth, and fifth. And then you want to move over to that apical impulse point. And her heart rate is about 72 beats per minute. And then I'll do the same thing but with the bell of the stethoscope, so I'll flip it around. And all the while you're doing this, you want to listen for your S1, your S2. Listen to your systole. And your diastole, and you want to listen for any heart murmurs or extra heart tones. Okay, so the next thing I'll have Justine do is you can also listen to the base of her heart and the apex of her heart by having her sit up. And just lean forward slightly for me. And we'll listen to the same points here. And when they're sitting up, it's more pronounced. You can hear it better. All right, sounds good. Lay back. So the next thing we will do is the peripheral vascular point of our assessment here. So what we want to do is we want to start with her arms. So what you do is you just kind of feel her arms. Temperature, color, if there's any swelling, the size, which pretty good. And then we'll check some pulses in the arms here. First you want to do your radial pulse, which is located on the thumb side of the inner part of your hand here. And that's a really strong pulse she has here. And then you'll want to check her brachial pulse, which is up here at her elbow. And then we want to check her epitrochlear lymph nodes that are located on the base, on the back side of her arm, down near the elbow. And you can palpate those by just doing this. You can feel them right there. So that's good. All right. And then the next thing we want to do is palpate her femoral pulses, which are right down here in the inguinal canal area. And you can feel those just above her hip bone. Right there, kind of where that V shapes. And then to feel her inguinal lymph nodes, you would feel further into her inguinal area, but I won't do that to you today. And then our next assessment, we just move down to the legs, doing both. Same thing, you just kind of want to feel for any swelling, color, temperature, if there's any abnormal skin colorations, which I see none there. She has a great temperature here. Few pulses that you want to check in the legs. You want to check the popliteal pulses that are behind the knee. So to do that, just have her flex her knee a little bit. Cup your hands behind. Take your 2 fingers on each side. And just kind of work your way in until you can feel her pulses, which are good. And of course you do this on both sides. And then down to her feet here. A few of the pulses that we have to check are your dorsalis pedis, which is on the outside of your foot here. And hers are nice and strong. And then your posterior posterior tibial pulse, which is at the end of your tibia here on your foot, right behind your ankle. And you can feel those very well too. All right. So I think that's our full assessment. Any questions?
Nope.
Okay. And that concludes our assessment today. Thank you.